Chapter 2, Chronic Kidney Disease and Treatment Options. 1, 2, 3. Yay! 1, 2, 3. Yay! 1, 2, 3. 1, 2, 3.
Kid D, what's wrong? Why are you dancing? The program has started.
1, 2, 3. Yay! 1, 2. Sorry. Would you like to join me for some aerobic dancing, doctor? So we are strong. La la.
Very active, Kid D, but they are waiting. Anyway, you probably have heard about chronic kidney disease, or CKD, but still don't know much about it.
If we want to know something, we should know it in detail. Okay, now let's learn more about CKD. CKD is the stage in which the kidneys gradually and irreversibly lose their functions. Many conditions can permanently damage the kidneys, such as 1. Diabetes, 2. Hypertension, 3. Glomerulonephritis and nephrotic syndrome, 4. Kidney stones and urinary tract infection, and 5. Polycystic kidney disease.
There are 5 stages in CKD. Stage 1, the earliest asymptomatic stage. We are able to detect only minor abnormalities such as small amount of albumin or red blood cells in the urine. However, the kidney function is still more than 90%. Stage 2, mild CKD. Kidneys function is less than 90%. However, most patients with stage 1 and 2 are asymptomatic, and the CKD is detected only through routine laboratory measurements or incidental diagnosis while evaluating other diseases.
Then stage 3, moderate CKD, where the kidneys perform at less than 60%. A patient may feel tired and not want to work as a result of the accumulation of waste products in the blood, along with elevated serum creatinine at levels above the normal range.
Stage 4, severe CKD, where the kidney performs at less than 30%. The patient looks pale, tires easily, and has poor concentration because the kidneys produce less hormones. Bone will start to lose its density. High blood pressure can also occur.
Then stage 5, end-stage kidney disease or ESRD, the kidneys function at less than 15%. A patient may present with drowsiness, confusion, easy bruising, feeling nauseous, and loss of appetite. Their feet will start to swell and there will be fluid overload in the body, causing problems to the heart and lungs, leading to breathing difficulties and in some cases death.
If you have been diagnosed with ESRD, you will need to be treated with kidney replacement therapy.
The kidneys of CKD patients will continuously lose their function over time if they are left untreated or not well taken care of. Nowadays, there are 3 treatment options for end-stage kidney disease.
They are 1. Palliative care, 2. Dialysis, 3. Transplantation.
Palliative care is a treatment for the patients with CKD stage 3 and 4 or with ESRD who do not want dialysis. Your doctor may prescribe several medications such as antihypertensive drugs, phosphate chelating agents, diuretics, vitamins, and sodium bicarbonate. You will also need to take care of your diet to slow the progression of the kidney disease and to prevent uremic symptoms. This can be done by reducing the amount of meat consumed and avoiding any processed, canned, or preserved food. You should cook for yourself and limit the amount of salt, fish sauce, soy sauce, curry paste, MSG, seasoning sauces, and powders used. In addition, you should restrict the amount of fluid intake and avoid any whole grain products, milk, soft drinks, and cocoa drink. For further information on diet, please see Chapter 5.
Dialysis can be performed in 2 ways. 1. Hemodialysis, and 2. Peritoneal dialysis.
For hemodialysis of HD, a dialysis machine cleans your blood by taking your blood with waste products through plastic tubes to the dialyzer that works as an artificial kidney. Once the blood is cleaned, it's returned from the dialyzer to your body. The average treatment time is 4 to 5 hours.
If dialysis is ceased, waste and excess water in the body will gradually accumulate as a result of food ingested and the byproducts from metabolism. You will need to receive dialysis 2 to 3 times a week for the rest of your life. This must be done either in a hospital or a dialysis center.
With this modality, a doctor will create an access to the bloodstream ready for the dialysis treatment.
Yes, there are 2 types of vascular access. First, the permanent type, which can be divided into 2 subtypes. The patient's own blood vessel, arteriovenous fistula or AVF, or an artificial blood vessel, arteriovenous graft or AVG. The latter is for a patient having vascular problems, such as a diabetic patient. A permanent blood vessel is easier to take care of and lasts a longer time, although it needs to be prepared 2 to 6 months in advance.
The second type is temporary vascular access, which is done by inserting a plastic tube into a large vein in the neck or groin areas. It should only be used on a temporary basis as the tube can be blocked and easily contaminated. Furthermore, it may cause an obstruction of a large vein in the chest.
An advantage of HD is that the dialysis machine can eliminate the waste in a short period of time. This is suitable for a patient who is unable to take care of himself, and there is no need to perform a dialysis every day.
However, the disadvantages are that the patient will have to travel to a dialysis center 2 to 3 times a week and is required to be on a strict diet and limit fluid intake. They are also at risk of complications such as hypotension, bleeding, and cramps. There is also the need for 2 needles to be inserted each treatment.
The second modality is a peritoneal dialysis or PD.
PD cleans the blood by filling your belly with a germ-free PD solution. The solution stays in the cavity while waste products and excess body water is moved from your blood. After 4 to 6 hours, the dirty dialysate is then drained out and the abdominal cavity is then refilled with fresh solution.
Each exchange takes 20 to 30 minutes, after which time you could continue your normal activities while carrying the dialysate inside the abdomen. This process has to be done 4 times a day so that the waste in the body is continuously eliminated.
With this treatment, your nurse will train you and your family on how to perform dialysis by yourself at home. You are also required to have a PD catheter or a Tencoff catheter implanted into your abdomen to allow the PD solution to go in and come out.
The advantages are that the waste is continuously removed. Only 1 operation is required. You can do it yourself at home, and you can have a more liberal diet than HD.
However, the disadvantages are increased risk of peritoneal infections and stomach discomfort as a result of fluid in the abdomen. Sugar in the PD solution can cause weight gain and difficulty in blood sugar control. A patient will have permanent external catheter in their abdomen. For both HD and PD, ideally the patient should have a sufficient pre-treatment period of 2 to 3 months prior to starting dialysis. They should not rush into making a decision while there is a pulmonary edema, as time is required for the AV fistula to mature and the exit site of a Tencoff catheter to heal. And the last treatment option is kidney transplantation. A kidney transplant requires implantation of a healthy kidney from another person into a patient whose kidneys are no longer working. A kidney may be donated by a living donor who is a direct family member or from a deceased donor whose kidney is still functioning.
This method is considered to be the most effective treatment for ESRD at the present time. A patient will have a better quality of life as they are not required to have a HD 2 to 3 times a week or a daily PD. In addition, there are less dietary and fluid restrictions.
Nevertheless, the patient with a transplant will have to take immunosuppressive agents for the rest of their lives to prevent rejection of the new kidney. Thus, the patient is susceptible to infection. Avoid crowded places such as cinemas, public transport, and people with infections. The patient will be instructed regarding the side effects of their medications, such as a swollen face, acne, cataracts, diabetes, peptic ulcers, hypertension, and osteoporosis.
A living-related transplant has a better outcome if a donor sibling is not possible. A kidney from a father, mother, husband, or wife who has been married for more than 3 years, or a close relative who has proof of a relationship can be used. There are several steps and risks involved in kidney transplantation. Please consult your doctor before making a decision.
First of all, there are 3 points to consider. 1. The blood group of the patient and the donor must be matched to reduce the possibility of transplant rejection. 2. Similarity of HLA or human leukocyte antigens between the patient and the donor is necessary. 3. A negative result of tissue cross-matching between the patient and donor.
In case you are waiting for a kidney from a deceased donor, you will need to contact the hospital where the kidney transplant is performed. You will be required to have a complete physical examination and some investigations. The average waiting time for a transplant is several years. While in the meantime, the patient will have to undergo HD or PD.
The cost of HD and PD is something that you should take into consideration as well.
While in general, hemodialysis costs about 1,500 to 2,000 baht.
There are a few categories regarding the PD reimbursement scheme as shown in the table. If you have any questions or concerns, please contact the relevant authority. You can also find more information from the website or the hotline as shown here. The cost of kidney transplantation varies according to the benefit you have chosen. For instance, a health insurance. Please contact your hospital for more information. The information we have given here is very useful. Please don't forget to share this with the people you love for a better understanding about kidney disease.
That's right. We still have more useful information about kidney disease for the next time when we come back. Please don't forget to share this information with other people as it may save lives.
Of course I will. See you next time.
Goodbye.
Goodbye.